Starting in 2014, with a few exceptions, most of us will be required to have insurance or pay a penalty. The penalty will start at the greater of $95 or 1% of income for an individual. That goes to $325 in 2015 and $695 or 2.5% of income in 2016. Unlike individual plans now, after 2014 there will be no medical underwriting. The new individual plans will have no pre-existing conditions, no lifetime maximums, 100% preventative care including pediatric dental. Due to the many mandates on the individual market, we expect a significant rise in premiums, especially for younger people. In some cases, these increases will be offset by premium and out-of-pocket expense subsidies, which we will explain. Many employers will continue to provide insurance benefits to their employees for the same reasons they do now. Employers with 50 or more full-time employees must provide insurance or pay a fine. Employers with less than 50 full-time employees may still provide insurance, but it's not required and they're not subject to a fine if they don't. There will be two main types of exchanges: public exchange and a private exchange. Public exchange will be set up by the government, while a private exchange might be established by an association, affinity group, or an insurance broker. You can compare plans yourself or you can use an agent or broker. The cost of the plan, whether bought on your own or through an agent, will be the same with no additional cost for their services. The public exchanges are state-based and the rules will vary from state to state. Several states have refused to participate. It's important to remember that health reform is a federal law. If a state can't or won't set up their own exchange, then Washington will do it for them through a federal exchange. After a time, some of these states may decide to set up their own exchange. Colorado will have its own state exchange. Starting in 2014, Medicaid eligibility will be increased to 133% of the federal poverty level. Those with incomes below 133% of the federal poverty level will be eligible for Medicaid. Subsidies will be available up to 400% of federal poverty level. If income exceeds 400% of the federal poverty level, or you have affordable coverage available at work, then you will likely not qualify for a subsidy. As income increases, the amount of the subsidy decreases. It's important to note that subsidies will only be available for plans obtained through the public and not the private exchanges. Here's an example. The source of our information is the Kaiser Family Foundation website, kff.org. Let's take a hypothetical family of four. This family makes $93,465 a year, or 399% of the federal poverty level. In 2014, their estimated premium is $14,245. Because this family is below the 400% federal poverty level cutoff, they can qualify for a $5,366 subsidy. Subtract the two and get a net premium of $8,879 per year. Now let's take our same family of four and say they work hard and earn $500 more for the year, totaling $93,965. This puts them slightly over 400% of the federal poverty level. Their estimated premium hasn't changed and is still $14,245. But since they exceed the 400% cutoff, their subsidy is zero. The extra $500 in income costs them $5,366 in premium subsidy. Again, these figures are only illustrative, but you can see where a little planning might go a long way. Here's a timeline for implementation. Open enrollment in the exchange is scheduled to start October 1, 2013 for a January 1, 2014 effective date. It won't be Black Friday where you have to get it all done on one day, but there will be a couple of month window to get your application in. Consumers will be able to work through us on or off the exchange. We welcome your business and we expect to be able to add value by assisting in the process and advising how to get the most for your healthcare dollars. The premiums will not be higher if you use the services of an agent or broker. We realize this is a brief summary of a complicated law. If you have any questions, we encourage you to call or email us. If you would like to receive updates, please subscribe to our mailing list or join us on Facebook. Thank you.